Thank you for joining us for another episode of Spotlight Houston, where we shine a light on the coolest people, places, and events in the greater Houston area. This week, we're revisiting a powerful conversation with Kevin Meyer, President and CEO of LifeGift. Kevin sits down with our host, Blanca Quesada, to discuss how saying yes to organ and tissue donation can give hope and second chances to those in need. This is episode 111, a special replay that originally aired as episode 52 on August 14, 2023. Spotlight Houston is brought to you by Story Zone Media. And now your host, Blanca Quesada.
Did you know that August is National Organ Donation Month? Well, I do. So I think it's really important that we talk about it. Organ donation is one of the most amazingly incredible gifts that we can give, because we will not only help the person in need continue their life, but we're also helping their families, their loved ones. We're helping to provide hope for them. So today with me is Kevin Myers. He is LifeGift President and CEO. He has more than 25 years experience in the organ and tissue donation and transplant community, and proven expertise in clinical research, patient safety, and healthcare system leadership. Welcome.
Thank you, Blanca. Thanks so much for having me. And we appreciate, on behalf of LifeGift and our organization, our board of directors, we really appreciate you having me on today.
Well, I'm really excited because I know that you're here to talk to us about how LifeGift, this fantastic organization, helps us to understand how being a donor actually works and how you help those needing a transplant. What is the mission of LifeGift?
Oh, that's such a great question. So it's pretty simple in words, but it's pretty complicated in actually carrying it out. The words are, we offer hope. And the term hope is so important because what it represents is that for families who are losing a loved one, who want to donate organs to help others, and tissues and bone marrow and so forth, it gives them an opportunity to, again, see some vision of hope in the midst of incredible tragedy. And then on the other hand, the candidates or the recipients who receive these organs or tissues, it gives them hope to know that they have a great chance at a second chance of life, renewed time with families and friends and so forth. And in between those two ends is where LifeGift, where we do our work in partnership with transplant programs and the community.
So when you talk about organs and tissues, what are you mainly talking about? Is it like heart, lungs, kidneys?
Yeah, really. So for organs, we talk frequently about there are 8 potential organs whenever you have a donation situation, depending on the clinical or medical condition of the individual. So most people know about kidney donation, either through deceased donation or living donation, where people can give a kidney to a relative or a friend. Liver, lungs, heart, pancreas, small intestine, or bowel, as we call it. And lately, and of great importance, is kind of the 9th organ, which is bone marrow, which we're one of the first organizations in the country to be able to know how to recover bone marrow from organ donors, and it's extraordinarily important. Then when it comes to other tissue, there's skin for burn patients, heart valves for cardiovascular repair, bone, connective tissue, nerves, corneas, of course, that have been around for a long time in transplantation. Remarkable. And all of these are life-saving gifts to help people have, again, second chance of life and a renewed chance at meaningful life with family and friends.
As you said, it is remarkable. And I definitely agree with you. I have a personal story. I had a friend who was pretty young. He was in his 20s and needed a transplant, and he was blessed to get one. It was, of course, kidney transplant, but the donor and his family certainly gave him the gift of life, because he lived up to his 60s and he was able to get married, had kids, saw them graduate from college, got to play with his grandkids. So he had an amazing life. And that's all because this person who unselfishly gave him this gift, the gift of life.
Yeah.
So, yes.
Yeah, amazing.
It's very important.
Amazing. So nice to hear such a nice story. That's great.
Yeah. So to me, LifeGift is a very important organization because I know what y'all can do. Yeah. So a lot of donors may have fears of donating their organs or tissues. What are some of the misconceptions of being a donor?
One of the biggest misconceptions is, or challenges that we have that limit more people from donating, is sort of a generalized mistrust of the healthcare community. Unfortunately, there's fear that a person, if they register as a donor, that they may be declared dead prematurely or something like that, which is absolutely not the case, because specifically in organ donation, to have that happen sort of from a medical perspective, all of the organs have to be working really nicely. So that means that there have to be interventions and so forth to make sure that the kidneys are working, the heart's working, and all that. And so that doesn't happen. There's no premature declaration of death. In fact, the healthcare team has no idea that an individual is a donor or not a donor until they're at that particular point in their care where they're declared dead or very close to being declared dead. And that's through the donor registry and so forth. Other misconceptions are about a concern about being able to have an open casket funeral, which you still can have. Concerns about costs. So there are no costs to the family of the donor. Those costs are picked up by the organ procurement agency, which is what LifeGift is. And then generally, just overall, the evolutionary fear of death and not being comfortable speaking about it, and certainly is not anything anyone wants to talk about. But that general fear, the general discomfort with losing someone or losing our own lives, it's a very difficult area. However, the amazing technology and the amazing transformation that happens with transplantation, all the technology, all these great minds that are working as, surgeons and physicians and nurses and coordinators, it all happens for one thing. It happens with the yes, one word. It's so powerful. There's nothing else like it in healthcare, where everything starts with just a simple word, yes. And that's very powerful. So it's quite an amazing thing. So despite all the fears that are in the community that we deal with and we try to educate the community with, people still donate. People still want to help their strangers. They still want to help their communities. And it happens because they say yes.
Well, we live in a city that is enormous and extremely culturally diverse community. And so a lot of people may be coming from countries where they hear about organs being harvested to sell. And so maybe they still think that every country does that. That's happening here in Houston.
Yeah, Blanca, that's a great point. Yeah, Houston is the vanguard of America. Our beautiful multicultural diversity that's how our United States is going to look. And we deal with this, and our staff, we have such a talented group of individuals who work with families in crisis when they're losing someone from all over the world. And as you pointed out, in Houston, we have people from everywhere. And we do have situations where some families will come to us and they'll want to know about the market, the illegal market, or has someone been prematurely killed for their organs and so forth. So our staff, who are specifically trained, many times from multicultural communities themselves, and they have empathy, they understand the experiences of the people they're speaking with, and they can help explain to them what is happening, why nothing nefarious is happening. They can explain that to them. Our organization, LifeGift, is so diverse. We have an extraordinarily diverse workforce. It's one of our greatest strengths. And again, it's more than the words about multiculturalism and diversity and equity and inclusion. It's about empathy and having staff that know, and our organization, LifeGift, knowing as best we can, having the ability to relate to people who are experiencing loss and having the ability to understand a little bit maybe about their backgrounds and some of the fears and concerns and challenges that they have and opportunities.
Yeah, I'm sure that they do go in with a lot of fears, but the important thing is that your staff creates trust and understanding.
That's exactly right.
So
I got to tell you, Blanca, in this day and age, there are so many things that people are concerned about in our communities and people caring for other people and so forth. The work that we do, we see people at the worst times of their lives having just this incredible generosity and trust in speaking with the healthcare team, speaking with LifeGift staff, being willing to say, I want you to help someone else. 60% of Texans are registered as organ donors. Did you know that? 60%.
Wow.
14.5 million Texans are already registered as donors. So I always am very proud to say that Texans donate life. And when you tell people that, there's some people who are surprised. There's a lot of people that are like, well, of course, that's Texas. It's a fascinating thing. And we're growing. The Donate Life Texas registry is growing every single month. And we think that by the end of this year, we'll be over 15 million people. So that's a very important indication that Texas does support organ donation.
Yeah. And that's something that people don't think about, but I think that they should. So how is it that we can register to become a donor?
It's so easy. In this day and age, it's one of the easiest things to do. So 2 ways. Number one, the most common or frequent way is when we go to the DPS and we get our driver's license, or we renew our driver's license, or if you're a youngster, when you get your learner's permit or your first driver's license, you check the box. You register as an organ donor. And so then that information goes in a secure database that's accessible only to approved individuals at an organ procurement organization in Texas. And then when someone meets criteria for donation, we can check to see if they're a donor. The second way is if you don't have a driver's license and you didn't get a chance to do it when you got your ID card or so forth, you can do it online by going to donatelifetexas.org. You just go online, you put in your identifiers, it's all secure, confidential, and then your name will go into the donor registry. So it's pretty easy.
Great. That's easy. Yeah, that's easy. Just go on.
Yeah. And then the other thing is that there's sort of an important part of that. It's not required to be a donor, but when you make that decision, it's really important for you to tell your loved ones, certainly tell your partner, spouse, and ask them for their support in your wish. Now, if an individual is registered, and this is often confusing to people, if an individual has made their decision to be a donor, they will be a donor if all the medical criteria and stuff line up. So it used to be years and years ago that if an individual was registered, but the family didn't want it to happen, we wouldn't proceed. Now, all of the laws of Texas, all the laws of the United States say if you're registered as a donor, that authorization is sacrosanct. And we must honor that wish for that individual to be a donor. And we do.
Great. That was going to be my next question. Well, because before I used to hear that a lot of relatives would not want to grant the person's wish. And so then there was loss of organs because the relative wouldn't say yes.
Sometimes what we find in these, typically when someone is, not always, but typically when someone is a potential organ donor or going to be an organ donor or a tissue donor, it's acute, it's sudden, it's a motor vehicle crash, it's a gunshot wound, it's a sudden stroke, it's all the bad things that you can imagine. And it's sudden and unexpected. So what we see is sometimes where we go talk with the family, the next of kin, and they're saying no right off the bat. And so our staff at LifeGift and other organ procurement organizations have enough experience to know that sometimes that first no from a family really isn't a no to donation. It's a no to everything. It's a no to just want everything.
They're going through so much. Yeah.
So our staff, our team, they know how to take care of the individuals, how to help them explain what they're feeling, how to help them understand what the opportunities to help other people are. And the majority of the time, it's the family, spouses, next of kin will authorize donation if the individual isn't already in the registry. If the individual's in the registry, they're authorized as a donor.
So who doesn't qualify to be a donor?
Oh, that's a good one too. Not many people, actually. In this day and age, the need is so great. And years ago, people would say, you know, I'm 60 years old or I'm 70 years old. I'm too old to be a donor, so I'm not going to register. Nobody needs anything. Well, 70 is young. 70 is young in our world. And so it's more about how a person's medical history has been and the kind of life they've lived more than about the years. So even people who may have diabetes or people who have high blood pressure or have had a stroke or some of the things that happen is throughout life, and these are chronic conditions generally, that doesn't prevent someone from being an organ donor. What we do is we look at each individual case, we obtain the medical history, we do lots of tests, and then all that information is kind of packaged up, and then we run a match list. And so the patients who are waiting for organs, some of them, maybe the organs aren't appropriate for that patient, but they may be for others. And so that is a decision that is made by the transplant center, wherever that patient is. And it's also what we've seen too over the years. In the last 10 years, it used to be, prior to even actually 5 or 10 years ago, if a person had hepatitis B or a person had hepatitis C, or if a person had HIV, they couldn't be a donor. That is not true
Right.
anymore. People who have hepatitis B, there's not many people who have hepatitis B anymore, but because of vaccinations. And then for hepatitis C, there are new medications out that actually prevent the progression of hepatitis C virus. And so that has been very helpful in helping to increase availability of hearts for transplant. And then LifeGift was one of the first organizations to help support the research that was needed to find ways to safely recover organs from patients who are HIV positive. And those organs can be used in some circumstances in other patients who are HIV positive. It's remarkable.
Yeah, it really is remarkable. And I'm sure that family members, when they agree or say yes for their donation, feel a sense of peace somehow, knowing that their loved one in a certain way continues to live in the person of whoever got the organ or tissues, and knowing that their family member, their friend, was such an incredible and unselfish person to provide that gift.
Yeah, it's amazing. And sometimes when we're talking with families about the opportunity to donate, families may be kind of going back and forth. We'll often ask the question, well, what kind of life did your loved one live? How did he serve the world? Or what did he do in his life? How was that, he or she? And then they start talking about, well, he would always help a stranger. He'd give someone the coat off his or her back. And then people start going, my gosh, giving life is so consistent with his or her whole life. And then I've seen it happen where it just, you see it dawn on the face of the individuals going like, I get it. This is our chance to honor their life because they've always given. They've served in the military,
Right.
They've been police officers, emergency services, teachers, healthcare folks. It doesn't matter. Anything in the work where people were generous, and then people line this giving up with that. And it's remarkable to see.
Yeah. And earlier you mentioned something about living donors. How does that work?
Yeah, so this is a really important topic. So there's such a tremendous need for kidney transplantation. We have so many people, particularly in Houston and also in Texas, across the country as well. So many people with kidney failure on dialysis. And on dialysis, it's very difficult. It's a long, slow process. It's very difficult. So some people have good fortune to have family members or friends who are healthy enough to be able to give one of their 2 kidneys after extraordinary testing and matching. So they can give a kidney and that kidney can be transplanted in their family or friend. And thus, living kidney donation is very successful. So we don't specifically work in that area. That's generally coordinated by a transplant center or group of transplant centers, but we support it. It's all part of donation and transplantation. And then there's additionally another type of living donation called living liver donation. So the liver is an incredible organ. You can actually take a section off of the liver and transplant that, for example, adult to child or spouse to spouse, and that liver will actually regenerate in the donor.
Wow.
And then the other patient, they have their diseased liver replaced. It's remarkable. Yeah.
Yeah. I'm sure there might be some complications with some people for various reasons as
Yes,
well.
there can be. It's something that it's a very safe operation and procedure and a very safe process. There are so many requirements to be able to be cleared to be a living donor. But like all things in healthcare, all things in surgery, it does involve a certain degree of risk, but there's so much experience with this now. The transplant programs that do this, most do, are so careful about this. They don't want to inflict any harm on the living donor, but it also is a remarkable gift.
Yeah. I know that recently you launched a new innovative neonatal donation
Yes.
program, saving lives from the earliest
Mhm.
moments. Can you tell us a little bit more about
Sure.
that?
Yeah. So in situations where there will be a neonate, so that's a newborn, and the newborn is not going to survive or is already in the process of dying, there are incredible needs. They're very unique and we're talking very small. It used to be in many places don't deal with organ donation in the youngest of children below 3.5 kilograms or below 10 pounds, just because it's very complicated. And so our group has put together a team that when these situations happen, they go into action. And parents are so generous in wanting to find something good that can come from a very tragic and sudden, loss of a new baby. And
Yeah.
so,
Yeah, I can't even imagine what they're
yeah.
feeling.
And so there's a myriad of opportunities for donation. There are some where in neonates, you can do a partial heart recovery, so partial heart transplant, which is very new. There's only been one of those done in Texas, and there's just a few across the country. We're part of that. And then, multiple other types of tissues that can be donated, heart valves, if not the whole heart, some of the cardiovascular tissue, which is then used in other babies that are born with congenital heart problems. And when you transplant in the very, very talented cardiothoracic surgeons make those repairs in those babies' hearts, on the regular patient side, guess what? They will need a heart transplant. So it's an amazing, like full circle type of thing. It's just unbelievable. Yeah.
To me, it's incredible what doctors
Mhm.
can do
Very talented.
because yeah, you can donate an organ, but if the doctor doesn't know what he's doing, then that's an organ that's gone to
Absolutely.
waste, right?
Absolutely.
So you have these incredible physicians that do this
Right.
every day and they get better and come up with innovative ways to do what they're doing a lot safer and better,
Absolutely.
basically.
And we're so
Yeah.
fortunate in Texas. We have really superb transplant programs and transplant centers in Houston and in Fort Worth and in Dallas and in San Antonio. And I could go on and on, Austin. We're so fortunate. We have 10,000 people in Texas on the waiting list. 10,000 people in Texas, 10,000. And most of those people who are waiting for kidneys, so they're on dialysis, and others are in intensive care units right now, just waiting, or at home with a mechanical assist device or something else, some of the newer technology, and they're just waiting for the call. And so Life Gift our lights are on 24/7, every day, all the time. We're working all the time. And just like our hospital partners are working hard to take care of patients and get them out of the hospital. But sometimes bad things happen. And then we're able to come in and try to find something good out of just something so bad. And we're able to help a lot of
Mhm.
people. And that's a privilege.
Yeah.
Yeah.
Yeah. Well, this new program sounds amazing as
Yeah,
well.
we're proud of
You
it.
know? Yeah. And when we carry around our Texas driver's license and it says we're donors, is it only Texas patients that get the donation
No,
or is it anybody in
it's
this?
anybody anywhere. Mostly because of our waiting list, it's going to be, and because of time and distance reasons for how long organs can be preserved out of the body or on a machine. But it'll generally be closer towards Texas, but it could be anywhere with kidneys, could be anywhere now because we have what's called broader sharing in the United States. But sometimes some organs will go to Canada, sometimes organs will go to Mexico, not as much, but eventually one of my dreams is I'd love to see before I leave this earth, I'd love to be able to see that there's organ sharing internationally. And as we get more, because
Yes.
of there's so much associated with matching, right? So, and some of that is based on ethnicity and country of origin. And now that we're getting better technology to send organs further, and here's an example, an organ donor in Hawaii who donated their heart. It went on a preservation device and they were able to fly that. We were not our organization, but a sister organization from Hawaii all the way to Boston and transplant that heart. And then just a few weeks ago, all the way from Alaska all the way to Boston. And so those are long distances. But yeah, so it doesn't matter what your state is in terms of where you register. There's also a national donor registry where the information pipes into the national one. So let's say something happens to me and I'm driving through Minnesota and I have a Texas driver's license, or they find me in the registry. Because I'm a citizen or a resident of Texas, I'm a donor. Doesn't matter where I am in terms of where my gift would be.
Mm-hmm. Hopefully, the medical community can come up with some way to preserve these organs so that they can make it around the
Yeah,
world.
wouldn't that be awesome?
Yes.
There's work
Yes,
being
it-
done. There's work being done. And it goes both ways, especially, you have, again, a lot of it is based on tissue typing, very complex tissue typing. And the better the match, the longer the organ ideally will last in the recipient. And so it's so much about that. It's fascinating.
Yeah. Yeah. And also, the other thing too, when you need an organ or tissue, it doesn't matter where you come from, if you're an immigrant or not. It doesn't matter the color of your
True.
skin. You can get that
True.
donation.
That is absolutely true. Yeah.
Yeah. But personally, what is the most important thing you want our listeners to know about Life Gift?
I think the most important thing to know is that we're here. Our entire job and focus is to take care of our community. So that's our job, is to help work with hospitals when people are losing someone, help them make a good choice about organ and tissue and eye donation, and then coordinate that in the best possible way to give as many people the best opportunity for a second chance at life. We're here. Our whole existence is about trust and hope, and that's what we're here for. And so we really consider ourselves of service to our community and to our hospitals and the people who are waiting. And so it's such a great opportunity to do something good. So it's always a privilege for all of us who work at Life Gift.
Yeah. And your door's always
Yes, ma'am.
open to anyone that has questions or needs to know how the whole system works.
Absolutely. And our website is, of course, www.lifegift.org. There's lots of information there. There's an opportunity to ask questions. We're open 24/7. And if you have your listeners, your audience, if they have any requests for further information for their organizations, we love to come talk. We love to do programs virtually or in person, and we're happy to share information. We love to talk about this.
So do you have a phone number where someone can call the 24/7 line?
The actual best thing to do is just go to the website, and then we have a whole series of different numbers. If you just go to Life Gift, you just look at About Us or Media and request information. We have a whole community outreach group that are responsible for getting back to our community members and so forth. So that's the easiest way to do it, because if I give you one number, it's just going to take you towards one place.
Right,
And that way your
right.
listeners can decide what section they want to go to.
And you have representatives that can go out and speak in different
Yes, ma'am.
languages too, right?
Oh, and we have
Right.
and of great importance, we have our ambassadors of hope. And those are our volunteers, many of whom are donor families or actual transplant recipients. And they do most of the community outreach. In fact, they come out and talk about their stories and share the stories that they went through and are going through. So they're a wonderful resource.
Well, yeah, testimonials always
right.
help.
Yep.
Yeah. And it's really important to remember that when you give the gift of life, you're also giving that person and their family, as you mentioned earlier, lots of hope.
Absolutely.
Lots of hope. Well, Kevin, thank you so much again for joining me today and for letting us know how we'll be able to help someone continue their life when we register to be a life-giving donor.
Thank you. Thank you for having me, and thank you for letting me talk about Life Gift. It's my favorite thing to do. And we really appreciate you helping us get the word out. And
Definitely. And as always, I'd like to thank y'all as well for being with me for this edition of Spotlight Houston. And if you have any ideas for a special show, just let me know.